Well, hello everyone. Are you worried that red meat could be damaging your heart? Um, Today we're going to have renowned heart surgeon Dr. Phillip Ovadia. He's returning again to bust these myths and reveal the truth about the carnivore diet and heart health. So, if you or someone you know has heart disease, this video is for you. So, go ahead and share this video with them so they can have an opportunity to hear from Dr. Ovadia. You don't want to miss this episode of Carnivorous Grandma Speaks, chatting with the docs. All right, so I'm bringing Dr. Ovadia in. Hey, Dr. Ovadia.
Hi, how are you?
I'm good. Welcome back.
Yes, it is good to be here again.
Yes, I'm super excited to have you back on the show and very thankful that we have a chance to go ahead and continue our conversation. I kind of want to just talk a little bit about the conversation that we had last time you were here and maybe give a little bit of a recap. So, we talked a lot about metabolic syndrome and how we can identify insulin resistance. And so I just wondered if you could just talk a little bit about that as we get started, because I really feel like that's the foundation of where this issue is stemming from. So
Yeah,
if you could just, yeah.
sure thing. And you're right. It really is the foundation of where heart disease and honestly, most of the chronic disease that we, battle against is coming from. Insulin resistance is the key. So, insulin resistance basically refers to the fact that your body is no longer able to process sugar well. Insulin has many different roles in the body, but its main role is to assist your body in properly, breaking down, properly utilizing carbohydrates and sugar, and it helps to regulate our blood sugar. And when insulin resistance occurs, basically the cells of our bodies stop responding to the insulin, to the signals of the insulin. And this leads to a whole host of problems. One of which is my primary concern as a professional, is vascular damage, damage to the blood vessels that can lead to cardiovascular disease. So it is the root cause of heart disease. And this is what I really want people to understand and to take away from this. Insulin resistance, without question, is the root cause for heart disease. It has been demonstrated in many studies to be the top risk factor for heart disease. So if you're concerned about heart disease, if you're already dealing with heart disease, and your doctor is not focusing on insulin resistance, they are failing you. And you need to take charge of your health. You need to start asking them about insulin resistance. And if they don't know how to help you with that, it may be time to find a different doctor to work with.
So this is very interesting, Dr. Ovadia. I literally just got off the phone with my dad, who has had heart disease for as long as I can remember. And he just told me that his doctor told him, no, you cannot do a carnivore diet. Because I've been trying, of course, to get him to try one. Um, he's like, I don't know where to start, but I'm trying to, kind of coach him through it as much as I can. But yeah, his doctor just told him, no, you cannot. And then I mentioned to him about insulin resistance and metabolic syndrome. And he's like, well, I don't have insulin resistance. I'm just fat. So can you just remind us again of
Yep.
what the criteria are to determine for insulin resistance?
Yeah. So, when we kind of broaden out a little bit, right, we look at what's called the metabolic syndrome. This is sort of the clinical manifestation of insulin resistance. And doctors use 5 criteria to diagnose the metabolic syndrome. And those 5 criteria are your blood pressure, your waist circumference, your fasting blood glucose level, your HDL cholesterol, and your triglycerides. Anyone can look up what the criteria are for each of those numbers. You can actually go to my website, ifixhearts.com. There's a free quiz right on the front page. It will take you through those criteria and let you know where you stand. But these are, the criteria we use, and they kind of point us towards what are some of the indicators that we might have metabolic disease, we might have insulin resistance, right? So, to use your dad's own words, right? He's just fat. Well, that means that he has an increased waist circumference, and that's one of the criteria. And if he has a high blood pressure, if he has diabetes, again, these are indicators that he has metabolic syndrome and insulin resistance. And then, if he can kind of prompt his doctor to look at his cholesterol panel, and instead of focusing so much on the LDL cholesterol that most doctors focus on, look at the HDL cholesterol, look at the triglycerides, and these can be the other indicators. The bottom line, though, is for someone with heart disease, it is almost guaranteed that they have insulin resistance. And, this isn't like new science, something we've recently discovered. There was a doctor, clinician, scientist, who did his work in the 1970s, 1980s. His name was Gerald Reaven. And he showed that insulin resistance is almost ubiquitous in people with heart disease. In other words, of people with heart disease, more than 95% of them had insulin resistance when you test for it the proper way. Now, a lot of times it goes unrecognized because most doctors, like I said, aren't familiar with this. But that's, like I said, if you have heart disease, you have to assume you have insulin resistance unless you prove otherwise. And, you already mentioned, why do you want your dad to do a carnivore diet? Because low carb diets, of which carnivore is certainly, one of the options, are the best way to treat insulin resistance. And so I would tell your dad, maybe he needs to find another doctor, or maybe hopefully, if he's not listening live, right, he'll at least watch the recording of this, and he can hear from another heart doctor that, yes, people with heart disease can safely do the carnivore diet. It's something that I recommend to my patients without hesitation and see good results from. So I'm not going to, tell him to ignore his doctor's advice. And it's important that people try and work with their doctors. But if they simply don't understand the basic concept, the basic driving force behind the disease that we're trying to battle against, that's probably a sign that that's not going to be the best doctor to take care of you.
Right. So I know that one of the things that we talked about last time you were here was the fact that you have metabolic syndrome and are insulin resistant means the lower the carbohydrate intake that you need to be having. So we talked about a little bit about vegetables and fruits and how those impact your insulin.
Yeah. So, and another important point, fruits, vegetables, right? These are whole, real foods. And everyone hears me talk about the importance of eating whole, real foods. But if you are already insulin resistant, if you already have metabolic syndrome, you may need to be careful. A lot of fruits are very high in sugar. And yes, they're natural sugars. And yes, there's some fiber that helps kind of buffer the end effects of the sugar. But you still have to be careful if you're insulin resistant. And one of the things I oftentimes recommend to people is, you can run the experiment for yourself, right? You can get a continuous glucose monitor. And this might be breaking news since the last time we spoke, but continuous glucose monitors are available over the counter. You don't even need a
Okay.
doctor to order them for you anymore. And so anyone can go get a continuous glucose monitor. They can wear it for 14 days and they can test for themselves the effects of these foods on their blood sugar. We can't test the effects of blood insulin directly, but we can see the effects of the blood sugar, and we can kind of, that helps us understand what's going on in our bodies, whether or not we're insulin resistant. Because I can't tell you for sure how your body might be reacting to different fruits and vegetables. Certainly the lower carbohydrate vegetables, those are things that most people are going to do fine with. But when you start getting into the fruits and you start getting into the higher carbohydrate vegetables, that's where some people who already have insulin resistance can, be getting into trouble. It can be making their situation worse. Now, the good news is, if you get yourself out of insulin resistance, and it is possible to reverse this, but if you get yourself out of insulin resistance, then you might be able to go back to tolerating some of those whole real food carbohydrates that were too much for your system to start with. But as you improve, you might be able to reintroduce them if you want. Of course, you and I oftentimes speak to our audiences and want them to understand that the carnivore diet is a perfectly acceptable diet to eat. And that is true whether or not you have heart disease. It's true whether or not you have insulin resistance. It's great if you do have insulin resistance and you're trying to reverse it. But it's even better if you don't have insulin resistance and you're eating this way so that you can prevent it from occurring.
Yes, I think I was listening to you, you talking about, the idea that yes, you can reverse some of these damaging effects. You can reverse some of these diseases, but it's better if you can prevent them in the first place. So I think that that is really a powerful statement. I think people are afraid to try carnivore, is what I'm seeing. They're so ingrained in the thought that you must have a balanced diet. And you have to have carbohydrates. You need to have fruits and vegetables every day. The whole apple a day keeps the doctor away type of a thing. But this is a valid and good way of eating that is anti-inflammatory. And so, can you talk a little bit about inflammation and how that plays into, how does that factor in?
Yeah, so inflammation is another very important factor when it comes to heart disease. Again, this is becoming increasingly recognized. In fact, there was recently, within the past year or so, a anti-inflammatory medication got approved for the treatment of heart disease. So we know that inflammation plays a role in heart disease, but again, it's one of these things that doctors kind of don't think about. They don't really put into their daily practice. That really, unfortunately, is because we didn't have a good treatment, right? It's not easy to treat inflammation. You can't just write the prescription, although now you can. There is an anti-inflammatory medication. It's called colchicine that is now approved to help treat heart disease. Again, not new information. We've known that inflammation in the blood vessels was part of the process of heart disease for a long, long time. And very well-established science, showing that. It was just a matter of how do we put that into practice, right? How I put it into practice is recommending a diet that is going to lower inflammation. And again, that eating whole real food, eating a low carbohydrate approach, can be carnivore, doesn't necessarily need to be. That is one way to very powerfully lower inflammation. And it's one of the things I see on a repeated basis. I was just talking with a new patient the other day, and they had recently started a carnivore diet. And I was kind of asking them about, what have you noticed so far? They hadn't really lost weight yet. But he said that the first thing that he noticed improving very quickly after about a week or two on a carnivore diet was his arthritis, his joint pain getting better, his inflammation getting better after he started eating a carnivore diet. So it shows us how powerful diet can be when it comes to inflammation. And again, we know that inflammation is key in the process of heart disease and other chronic diseases. Again, we look at things like Alzheimer's disease, cancer. These things show evidence of inflammation as well.
Wow. So, I wanted to ask you about other types of diets. Is there any other type of diet that is as beneficial? I'm thinking about, diets like the Mediterranean diet or the paleo diet. I've heard some, even the keto diet, low carb and keto, because I'm of course carnivore-ish. I still use some spices and stuff like that. So, are there any other diets that are as promising for heart disease?
Well, I think the whole low carb spectrum, right, is beneficial for heart disease. So, again, the choices between a full carnivore diet and a low carb ketogenic diet, that, there are lots of things that can factor into that decision. But I would say that all of the low carb diets do show benefit in improving insulin resistance and therefore lowering risk or improving heart disease. Eating whole real food, first and foremost, I think is the most important concept. So people will ask about plant-based diets, whole food plant-based diets. And yes, I do think those are an improvement over the standard Western diet, right? Anything that eliminates processed food, I think, is going to lead to some improvement. I just don't know that it's the best diet, right? My concerns around the plant-based diet. And the first thing to understand is it needs to be a whole food plant-based diet. A lot of the plant-based diets out there are full of processed foods, the fake meats and, all this other stuff that, it's junk food and it is not any better for you than, the rest of the junk food and the processed food. But if you do a whole food plant-based diet, I think that can show benefits. And, it's harder to do is really my main issue with it. You really have to be careful to make sure you're getting a complete nutrient profile. You have to supplement with a whole food plant-based vegan diet. Now, if you incorporate some things like eggs and stuff like that, and you're taking a more vegetarian approach, there may be ways to do that without supplementation. But, I just find it to be more challenging. And, again, these tend to be high in carbohydrate. So if you're already insulin resistant, that may be problematic for you. So
Okay.
those are some things to keep in mind. But ultimately, I tell people, right? I kind of like to keep it very high level. If you're improving your insulin resistance, if you're lowering your inflammation with whatever you're eating, I'm going to be okay with it.
Yeah.
I just haven't seen that happen on, many other diets besides the low carb diets.
Yes. I think I agree with that. I don't, of course, I'm not a physician, but I agree because I've tried all the diets. The only one I did not try was vegan because I'm not that huge of a fan of vegetables. So I'm like, I couldn't see myself going vegan. But having tried many, many different diets over the course of the years, I have experienced, so much yo-yo dieting, up and down, up and down. There was no, you know, there was really no diet where I could kind of maintain my weight for any length of time. It was always, going back to the kind of foods that I was eating before. And I find that carbohydrates cause cravings for me. So when I eat even vegetables, they cause some kinds of cravings. And then I end up, derailing myself from my goals by incorporating those types of foods into my dietary plan. Um, so I'm just curious because I sent our video that we did the last one to my brother-in-law, and he is in his early 40s. And a couple of years ago, he had to have a couple of stents placed. And so I'm curious, what is your take on this? I know that you said before that it used to be that it was just all older people that were having this kind of a problem with heart disease. But what is your take on what's happening with the younger generation? And, are they responding well to a low carbohydrate carnivore diet as well?
Yeah, that's pretty interesting. I mean, I have children, teenage children, and I do see more, I would say at least more acknowledgement among the younger generation of, you know, the foods that we're eating having an effect on their health. And I think they're starting to realize, right, the impact of sugar and processed foods. And obviously my children hear it all the time. But even among their friends, you start to see them kind of talking about this, thinking about this. And so that does give me some hope. Uh, the good news for the younger generation, right, is it's sort of good news, bad news, right? The younger you start paying attention to this, the better it is. The bad
Yeah.
news for most of the younger generation is they have literally been exposed to this stuff since birth, and we know the addictiveness of these processed foods. And, quite frankly, some of them, literally since birth, because most of the baby formulas on the market these days have things like vegetable and seed oils in them. And, are things that really probably I wouldn't recommend, for any infants and children out there.
Yeah.
So that does make it challenging. Now, the other positive development is this is really entering the national conversation, right? Not getting into any specific political beliefs here, but
Yeah.
nutrition has entered the political arena. The
Yes.
presidential campaign that's getting ready to wind up here in the next couple of weeks. This has become one of the issues that's being discussed. Robert Kennedy Jr. has really bought this into the national conversation, and the concept of, in order to improve our nation, we need to start paying attention to our health, and we need to start improving our health. And the way to do that is with a metabolic approach. I'm very, excited to see that entering the national conversation, and that does give me
Yes.
hope for the future.
That is awesome. That is awesome because I mean, I was listening to like some information around FDA regulations and how the lobbies go and have these conversations at the national level and influence our dietary guidelines, right? And so that's how we're here with the whole my plate and and so a couple of years ago or a few years ago when I was kind of interested in listening to this, it was very challenging for this conversation around, well, at that time it was keto. I There wasn't a lot of people talking about carnivore back then. Um, to talk about how, reducing carbohydrates could improve health. And it was very difficult for people to even get in to have the conversation. So it's very exciting to hear that conversation is happening at the national level, because the dietary guidelines come down from above, so we really need to have influence in those arenas and have conversations around how we can improve our health as we look around in our society and see that we're very, very sick. um, and how can any of us, including our children, be at our best when our brains don't work as they should? We're all walking around with brain fog and, eating a Snickers bar to try to get through our day, and those kinds of things. So I think that is really, really fantastic. I'm glad to hear that that is happening. And in fact, I think I have heard a little bit about it, but not too much.
Yeah, we want to keep pushing that message, hearing more about it. Nina Teicholz has been really
Yes.
spearheading this effort for so long and doing amazing work to try and influence the dietary guidelines, try and get the committee to recognize the benefit of low carbohydrate diets. They have been
Mhm.
very resistant to that. She has also helped to expose perhaps some of the reasons that may be, some of the conflicts of interest that arise in that committee. And
Yes.
now, again, to see others jumping on board, right? And Robert Kennedy talking about it, and Callie and Casey Means, and all these voices that are trying to bring this message to the forefront. Because honestly, it should be something that politicians are talking about, because it is a real threat to our country. And
Yes.
it's a threat on many levels, right? The economic costs of taking care of metabolic disease are literally bankrupting our country. Um, we look at the fact that we don't have enough people in good enough physical shape to fill the ranks of our military. And that's a threat, to our
Mhm.
country. And just again, the disability, the suffering that comes with these longstanding metabolic diseases. These are all things that are really having an impact on our society. And so this should be at the top of the list of issues that politicians are talking about. And again, I always tell people, right, you can't wait for the government to make the changes. You and I are probably not going to be, realistically, it's going to be way too late before the government really, admits the mistakes that have been made and changes the guidelines and all of that. But
Right.
the good news is that as individuals, we get to decide what we eat. We get to decide what our habits are going to be. So, I implore everyone to take charge of their health and start making the changes that you want to make. I go back
Yes.
to your doctor, talking about your dad and his interaction with
Mhm.
his doctor earlier. And what I would talk to your dad about is, um, you know, who has your best interest, right? And it's not that his doctor isn't thinking about, his best interest. His
Right.
doctor is just simply, ill informed. And
Mhm.
it is up to your dad whether or not he wants to try a carnivore diet. He doesn't need his doctor's permission to do it. And
Right.
you try and work with your doctors. You try and make that a respectful relationship, but ultimately it's up to your dad to decide what food he puts in his mouth. It's not up to his doctor to decide that. And
Right.
so that's the type of message that I want people to understand and to hear.
So here's the thing that I'm thinking about in terms of that, and that is the level of addiction that we have to these processed foods and how difficult it is to give them up. Um, I think this is a huge problem, if you think about the way the food is just so highly palatable. It really hits all those pleasure centers. And so that, people don't want to give that up. They don't want to give up their drug of choice, which is food. So that's also quite a challenge, I find.
Yeah, definitely so, and a very real problem. I believe that processed food addiction is a real issue. And there's a lot of debate that goes on, right? What is it about the processed food? Is it the sugar? Is it something else? That's causing this addiction. But we see behaviors around these foods, and believe me, I say this because I had them, I did them. Those same behaviors that we talk about when we're evaluating people for other addictions, alcohol, smoking, gambling, whatever it might be.
Hmm.
These foods have the same effects. And this, again, is something that we are discovering is not unintentional. These food companies, they have scientists, food scientists, that do the experiments, to figure out what will make the food more attractive. They would say addictive, I would say, but what will get people eating more of the food? Because remember, the goal of the food company is to get you to eat more of their food. And that is, they're a business. I don't blame them for that, right? That's their goal.
Right.
They're not concerned about your health. And that's what we, the consumer, has to keep in mind. But food addiction is processed food addiction is a very real problem. Um, Again, lots of great work that has been done around this by many, people that, some that come to mind are Bidden Janssen, Adele Height. There's been, lots of great work done around food addiction, and it is something that people need to acknowledge. And it is tough to overcome. And ultimately, the advice kind of starts to sound similar to any other addiction, right? It's very hard to overcome the addiction when you're still consuming the substance, right?
Yes.
We don't really tell alcoholics to keep drinking alcohol, just cut back, right? Smokers, same thing. You got to get off the cigarettes in order to overcome the addiction. And processed food, I think, is the same way. You got to cut it out. You got to get off it to be able to overcome this addiction.
Absolutely. 100% agree. I want to go back. I saw a comment come in and I want to just bring this up because last time we met, we talked about mitochondrial damage. So I kind of want to
Mhm.
talk about this, but this is Charlie, and Charlie wants to know, to what extent are heart healthy marketed canola oils actually good for heart health?
Yeah, I believe to zero extent, and I believe they are actually harmful for heart health. Um, the reason that the vegetable and seed oils, canola oil being one of them, got promoted as a benefit for heart health is because they will lower LDL cholesterol levels. And I don't argue that fact. They do lower LDL cholesterol levels. I would just argue that I don't think that's beneficial for heart health. And the reason that I
Mm,
don't think it's beneficial for heart health is because other effects that these oils, these vegetable and seed oils are having, um, yes, it lowers your LDL level, but it also causes your LDL particles to be smaller in size. And we know that smaller sized LDL particles are uh, harmful. They are the subtype of LDL particles that get involved in plaque formation. So that's one concern. These oils are also very high in omega-6s, omega-6 polyunsaturated fatty acids, linoleic acid in particular, that are pro-inflammatory. So they cause the inflammation that contributes to heart disease. And there have also been, studies that demonstrate that these omega-6s, right, the linoleic acid, can damage the mitochondria and can contribute to the development of insulin resistance. So they're making insulin resistance worse. They're making inflammation worse. These are two of the primary drivers of heart disease. And then, I would argue that while they might be lowering LDL cholesterol levels, they're making the quality of the LDL particles worse. And therefore, that's going to contribute to worsening heart disease. So I do not believe that these are heart healthy. And again, the studies really would back that up, because the best study done that looked at substituting vegetable and seed oils for, other fats, saturated fat, which was the primary fat that we consumed. That study, the biggest study, which was the Minnesota coronary experiment, as well as the Sydney Sydney diet heart study, they both showed that there was no impact on cardiovascular disease from consuming more of these oils, and there was a negative impact on overall lifespan, overall mortality in those studies. So it's a marketing term, and we know how that heart healthy label got on canola oil. The company paid the American Heart Association to be able to use that sticker, that label. That's all it means. And that's what we have to, that's what we have to wake up to as consumers. It is an advertising slogan and nothing else.
Wow. So I was thinking about this mitochondrial damage, and I wondered about, because we talk about the fact, you just mentioned it earlier, about the fact that from infancy, we are incorporating these toxic seed oils into baby formula, and it could be causing mitochondrial damage. So is that something that can be reversed? I mean, if your mitochondria is damaged, can it repair itself?
Yeah, I do. I would say that it can be. You're right. Our cells, our mitochondria, right? They're kind of renewing themselves on a continual basis. So I think when you stop doing the damage, there is opportunity. Now, understand that things like when we talk about these polyunsaturated fatty acids, the studies have shown that it can take many years to get these things out of the body, right? They get stored in our fat cells, and it can be up to a couple of years. Some studies have demonstrated, even if you stop eating them as much as possible, it can take a while. But we see people healing all of the time, and that can be measured on many different levels. But I do believe that I believe in our power to heal ourselves, right? When you stop damaging your body has the capacity to heal, to regenerate, to improve.
That is awesome. I was so concerned about that when I went back and listened to our conversation. Like, oh my gosh, once they're damaged, like, how do they recover? So that is really good news that we can, we can reverse that mitochondrial damage, but it could take a long time. I think I heard like maybe 7 or 10 years for those seed oils to get out of your cells, which is pretty wow.
Yeah, that data is concerning, and that study that most people refer to is that I believe it, like, the half life, which means getting half of it out of your system, was about 2.5 years. And so, you do the math, that it really can take 7 years, 3 half-lives to get most of it out of your system. So very concerning, to hear that, to see
Absolutely.
that data. And it just shows you the negative impacts that these foods have on our bodies.
Absolutely. So I wanted to ask about fat, since we're talking about fat. So I've been having some conversations around eating bacon fat, eating beef tallow, and people are concerned that that is going to clog their arteries and cause a problem for them. So they would rather eat a vegetable oil than an animal-based fat. So what is your recommendation around, cooking with fat?
Yeah, so my recommendation is to use the animal fats first and foremost. And that includes things like butter, ghee, tallow, lard. Those are the healthiest fats that we can consume. Of the non animal fats, the only ones I recommend are the ones that don't come from the seeds. They're the fruit oils. And these are going to
Mhm.
be, olive oil, avocado oil, and coconut oil. But I advocate for, and I personally use animal fats whenever possible.
Yeah.
And again, these we're in a situation now, right? That it came to be accepted, something that was never true, which is that saturated fat is harmful for our health. And then we're now trying to unprove, right, something that was never true in the first place.
Wow.
And because people have heard this their entire lives, and they're very programmed, to believe this, it is hard to get them to understand that it simply wasn't true. It's not even that it was true and now we've proven it to be false. It was
Wow.
never shown to be true. It was a hypothesis. It was a theory. The science that kind of supported that theory was never good quality science. And the good quality science that does look at the question has shown it not to be true. And this is, the some evidence of this, right, is that the American Heart Association has actually removed the limitation on saturated fat from their guidelines. They weren't they never came out publicly and said, "Oh, all that stuff we've been telling you for all these years,
Mhm.
don't listen to it anymore." They just quietly removed it from the guidelines, and they no longer, put a limit on saturated fat in the diet. So
Interesting.
people do not need to fear fat. They do not need to fear the natural, animal fats. And yes, they should be concerned about vegetable and seed oils. Those are processed; those are unnatural fats that our bodies don't know what to do with, right? We haven't been
Right.
exposed to these things for the millions of years that we have been exposed to animal fat, saturated fat. This is what we evolved eating. And many anthropologists believe it was the fat that allowed human beings to evolve, allowed our brains to grow, and allowed us to undergo that evolution. So there's no reason to fear it. And you know, that's what I encourage people to use for cooking and for
Okay.
consumption.
That is great. So I had a couple of questions come in, and I want to make sure that I take an opportunity to answer those. So right after our show last time, I got a message from Leah Aloha, and she asked the question, once you're insulin resistant, can too much protein spike your glucose on a carnivore diet?
Yeah, so too much if you're insulin resistant, too much protein can cause a rise in your blood glucose. I don't think it's the same as the spikes we see from consuming carbohydrates. It tends to be a more gradual rise. It doesn't go as high, and it comes back down. And so I don't worry about it as much. But what I do see sometimes happen for people that are doing carnivore diets if it's two situations. One is at the beginning, right, when their insulin level is high, because they're still overcoming their insulin resistance. And whenever your insulin level is high, it blocks your body from breaking down your fat, your stored fat. And therefore, you can't access your stored fat for energy. And if you're eating relatively, if you're not eating any carbohydrate, and then you're eating not enough fat to meet your energy demands, the body will sometimes turn to what we call gluconeogenesis, converting the protein that we're eating to glucose for energy instead of burning fat for energy. The other situation is people that have already lost a lot of fat, and their body sometimes gets to a point where they're like, we're not giving up any more body fat. So again, they don't have the body fat to burn, and sometimes protein can then get turned to glucose. Now, I don't think that's as dangerous, as damaging as the spikes that we see from eating sugar and carbohydrates. And usually it doesn't reach, like I said, that same magnitude. It's just that sometimes people on a higher protein carnivore diet, their blood glucose kind of runs a little bit higher than might be ideal. And oftentimes there are a couple of things I'll recommend in that situation to people. One is that they maybe up the fat and lower the protein a little bit. The other is, this is a situation where fasting can be very useful. And if you can start to extend your fasting windows, that can help bring the blood glucoses down as well.
Awesome. Thank you so much for your response to that question. And so you're kind of leaning into the next question that I got, which was, what about fat? Like, what is the recommendation around how much fat should a person be eating? Because I think people are nervous about eating high fat.
Yeah.
And so just wondered, what about the fat? Like, can we eat as
Yeah.
much fat as we want?
Well, I think within reason and depending on your situation, right? The first thing is make sure you're eating the right types of fat, like we already talked about. How much fat? Again, it's going to depend where you're starting from, what your goals are, how good your body is at utilizing body fat if you can access it, right? So if your insulin level
Mhm.
has come down and you have body fat to burn, it's preferable not to eat as much fat in the diet and let your body burn the body fat. If you're not able to do that, right, your insulin level is still too high, or like I said, you're either lean enough to start with, or, this is a relative thing after we've lost a bunch of fat, right? The body sometimes kind of, even though we may not be lean yet, we're lean compared to what we used to be. Those are situations where you may need to eat more fat to meet your energy demands. And, this can get a little complex. These are situations where working with a knowledgeable coach or a knowledgeable, medical provider can really help people to start to, fine tune the approach. But in general, my general approach to carnivore, I tell people, eat until, eat when you're hungry, eat until you're full, and, eat the cuts of meat that are most appealing to you, and don't worry too much about the fat to protein ratio. I think for most people it's really not the major issue. Sometimes we get hyper focused on some of these numbers, and
Right.
really it's just about giving your body the nutrients that it needs to heal. Unless you're eating, we talk about, there's something called rabbit starvation, right? Because rabbits are like so super lean, they have like no fat. And if you're
Mhm.
eating only that, right, people got into problems. But I really don't see that occurring in the modern environment with most, most of us. So unless you're eating really super lean stuff all the time, you're probably not going to get into a too little fat situation. And then I just tell people, adjust on, listen to your bodies, right? If you feel low energy on a carnivore diet, it usually means that you're under eating, and under eating fat in particular. So that's a situation where you may want to dial up the fat.
Awesome. Thank you so much for that. So, I wanted to ask about sodium. I know that we're getting close to being out of time, so I just definitely want to chime in on sodium
Yep.
because I feel that people fear sodium. We have been told that you can't eat too much salt. So, can you talk about sodium intake and blood pressure? And should people be eating a lower sodium diet? How does that fit in?
Sure thing. And full disclosure, the coffee that I've been drinking while we've been recording this has salt in it. So I think that may give some indications to people
Yeah.
on how I feel about this. So two things that I talk about on this topic. Number one is we need to differentiate between, good high quality salt, like a good sea salt, and the most common source of salt, of sodium, I should say, in the Western diet, which is in processed food. And those are two completely different things. So the
Okay.
studies that show, harmful effects from high salt consumption, high sodium consumption, we're all looking at high consumption of processed food. And I would say that first of all, there are obviously other things in the processed food that are driving the health outcomes. And you're dealing with, poor quality salt. You're not dealing with real salt. You're dealing with processed salt that has stripped a lot of the minerals and stuff out of it. So, again, I don't think people need to fear real salt. They do need to fear the salt that is in processed food. When it comes to high blood pressure specifically, we actually, the effects of salt on high blood pressure are actually variable. It's interesting. One of the treatments when people come into the emergency room with very high blood pressure, what we call a hypertensive crisis, is to give them salt. We give them what's called, normal saline solution, which is a high salt IV solution, and that can actually
Hmm.
bring the blood pressure down. We sometimes give what's called hypertonic saline, which is even higher salt, and that actually brings the blood pressure down.
Wow.
It's a little bit of a contradictory thing there to then say, well, eating too much salt is what's raising your blood pressure. There is a small incidence of true, what we call salt sensitive hypertension.
Mm.
That's actually a very small percentage of people with high blood pressure really have that. And even that, I'm not really sure it's truly salt sensitive. It's processed food salt sensitive, but I've never really seen someone, putting real salt on their meat and having that worsen their blood pressure.
That is fascinating because that is one of the main things that, like, in my family, I'm always thinking about these guys, right? So that they're concerned about sodium consumption
Yep.
because, they've been told, of course, by their physicians to limit their salt. And so, they don't even want a salty taste. They don't put salt on their food when they're cooking. So I'm like thinking about Christmas gifts that I can give that are real salt so people can, bring salt back into their lives.
Exactly. Don't fear the salt.
Don't fear the salt. I totally agree. I have two questions here in the chat. So I'm going to pop these up really quick. Bill Cook wants to know, is there any chance that McDonald's, Burger King, etc., will go back to saturated fats?
We can always hope. One of the things, again, a few days before we recorded this, right, there was a political, Donald Trump was at McDonald's, and the only thing I
Yes.
could think of was, man, I hope he's cooking those fries in tallow instead of the vegetable oil. That would be the dream.
That
Um,
would
you
be the
know,
dream.
again, and I think these companies respond to economic pressure, right? So that's
Yes.
going to be the only way that we can really get that. The reason they made the switch in the first place was economic, right? It's cheaper to use these vegetable and seed oils. Vegetable and
Right.
seed oils can be kind of reused more, for longer periods of time, and they're just cheaper to start with. And that's the reason they made the switch. And the only way they're going to want to switch back is if consumers demand it. So
Right. Absolutely.
let's hope so. I have noticed more restaurants that do kind of promote using not using vegetable and seed oils, and making fries in duck fat or tallow. You start to see that more on the menus as a sort of
Hmm.
they're promoting it. So I think that's a good start. But
Yes.
ultimately, consumers need to demand it, and hopefully it will happen.
I hope so. Okay, we got one more here. Do you nuance the carnivore diet approach to any based on gender?
Gender, no. I think it makes no difference whether you're male or female as to whether or not you can eat the carnivore diet. I know many successful, long-term female carnivores, and so women, again, shouldn't fear this, and should feel free to try it. The nuance that sometimes enters into the carnivore diet are going to be some things we talked about, right? The fat to protein ratio that may depend on your health status. And then the other nuance that comes into play is around autoimmune conditions. And people with autoimmune conditions oftentimes need to be very strict about the carnivore diet. Whereas generally people that are just looking for health improvement, trying to, deal with insulin resistance and metabolic disease, they don't need to be as strict. So, when you talked earlier on about, using spices, right? I think
Mhm.
that's fine for most people on a carnivore diet. But there are some people with autoimmune conditions that even things like spices can be enough to trigger a response, and they may
Yes.
need to do the very strict form of the carnivore diet.
So even I found out that I have a sensitivity to black pepper. So I really can't use black pepper. It does cause some kind of a response in me. So I just have I have a request.
Sure.
So my father-in-law about a year ago had triple bypass surgery and a heart ablation for chronic AFib. And so I would love it if you could just maybe say something to him. His name is Jesse. Of course, he has gone back on what I would call maybe a little bit modified standard American diet with the fruit and the vegetables. He was raised on a farm, so he's big into vegetables. But I'm just wondering if you could just maybe have a little word for him.
Yeah, I would tell Jesse, that he again should, first of all, it's not too late to take back your health, even after you've had the heart surgery. And eating whole real food and eating mostly animal products is not only safe, but I would say a recommended dietary approach for someone like Jesse. And again, I have no hesitancy in recommending a carnivore diet to my patients that are undergoing heart surgery. So keep fighting, Jesse. And like I said, it's never too late for Jesse and everyone like Jesse to take back control of their health.
Thank you, Dr. Ovadia. I really appreciate you coming back and finishing up this conversation. And you're just a wealth of knowledge, and I appreciate, you as one of the good doctors in the space that is out here talking. I appreciate the fact that you came over here to talk on my channel. You didn't charge me anything. So thank you so much. The generosity of you and other doctors that are in this space is absolutely, it's incredible. So I just really want to appreciate you and thank you so much for all that you're doing, and for all the people whose lives that you're changing. So thanks again for coming. I really do appreciate you.
Well, it's great to be here with you again, Robin, and thank you for helping to spread this word.
Absolutely. All right, you guys. So I'm going to have Dr. Ovadia's links down in the description box below. Thank you guys for coming and being part of this conversation today. Please share this video. There's somebody that you know in your life who has heart disease, or we want to prevent heart disease for. Maybe they have it in their family. And just because you have it in your family does not mean that it has to happen to you. So share this video, and we'll see you guys next time. Thank you so much. Bye, everybody.